things. Could be she had bad breath, and could be psychosomatically you're not really into her and you just want to get away from it. It could be you want the other guy on your team. Whatever, not that that's a bad thing. I'm not putting that down. I'm just giving an example. Of course, so he said, yeah, so we're trying to figure it out. I already knew that he probably had very sensitive baroreceptors, carotid baroreceptors, and that's what was doing it. He got vasovagal when she did that. So he said he had a beard, so he was shaving for a baseball picture, for the team picture. The shaving passed out. So he came in and told me, I go, this is what it is, blah, 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 blah. So, true story. So when a person has tachycardia, sometimes you can do a carotid rub, and that'll slow the heart rate down. Okay, some people are very hypersensitive baroreceptors, they can pass off by just doing that. So, cool story. All right, so interesting story. I should say cool. Wow or cool? Yeah, interesting. So one side, I think the video shows them using their thumb checking it. Never check a pulse with your thumb. 2 fingers. Sternocleidomastoid, medial to the sternocleidomastoid. He has a great carotid pulse. Okay, checking this side again. Do it enough where you can feel it a couple times and be done. Don't sit there and linger forever. Don't push too hard. That type of thing. Okay, so I've palpated that. Now I'm going to auscultate him. So these are in my ears. Have him hold his breath because you're listening for basically like a percolating sound or a brewing, if you will. So if you have him breathing, you might hear his breathing and mistake that for a brewing. So hold his breath, listen. You may or may not hear a pulse, but you really shouldn't hear too much of anything. If you hear a like a coffee pot percolating, you might have a stenosis in there, a little blockage. If he has 100% stenosis, he's not having anything going up there, so you're not going to hear anything. So that's where it kind of gets tricky. All right, so stethoscope's here in my ears. Hold your breath, please. Okay, great. Get this side. Okay, great. So I've auscultated, palpated and auscultated his carotid artery. Okay, arteries. We'll talk about later how to calculate if he has CHF, if he has JVD, jugular venous distension. But right now, I'm happy with this. Okay. So check that pulse. Now we're going to check the other pulse. Check his radial pulse. Obviously, his radial pulse is on the radial side. You're feeling it here. Do this side. Right pulses. Again, don't use your thumb. And then go ahead and just slip that sheet. Okay. You want to do dorsalis pedis, which is the dorsal side of the foot. And we would do the tibialis, or the posterior tib. So it's back here. Now, if you feel this one and you don't feel this one, that's okay, because if he's having circulation down to here, I'm sure this is working. I have no problem with this. If you feel this here, and you can't find this one for whatever reason, as long as his feet aren't blue or anything, I'm happy with that. All right? So as long as you find one of the two, life is good. If you find both, then you have the bonus. Okay? Whoever his partner is, he has both. So it's easy. All right? So dorsalis pedis, posterior tib, carotids, and then we get into the heart. So with the diaphragm, got my ears on. Always second intercostal space, right side. Oh, when you guys did lungs, remember anterior, just to go back. Anterior, remember to do up here. Okay, above the clavicle. Why? Remember the lung goes all the way up here, right? What if you heard something like bronchi or something up there, and you felt tactile parametus and everything changed up there? What's your differential? Really? Atelectasis? No. Okay, I can give you some vital signs. They have fever. Possible pneumonia. What else? Less likely, less. It's less, but it's still a possibility. So you have bronchitis. What other etiology could it be? you don't see it as much anymore. And you get checked, TB, okay? If you're down at Grady, or if you're at a inner city hospital, or if you're out on a mission trip somewhere, you hear something up here, TB likes to live up here, check it, okay? Think about it, right? So, do that, or it could be pneumonia too, apical pneumonia, right? So, second intercostal space, right side, second intercostal space, left side, pulmonic, tricuspid, fourth intercostal space, mitral, fifth intercostal space, mid-clavicular, okay? Again, a woman, either have them lift it up, or slide it to the side, or if it's kind of right in that in-between area, maybe you can just lift it up, just as long as you're not touching it, okay? And then that's it. Listen long enough to know that you hear love dub, and you don't hear anything else, okay? The last thing I want to jump into, and then we'll finish up with this and then check out at 11:30, is lay on your left side. PMI is the point of maximal intensity. Your heart should be, the point of maximal intensity should be in the same place all the time in all of us. Obviously, depending on our size and stuff like that, it might deviate a couple millimeters here or there, but should be in the same space, that maximum intensity. It can change if your heart's too thick, if your ventricles are too thick, your atrium's too thick, it'll shift that PMI a little bit. That gives you a little bit more information to come up with this diagnosis, and we'll talk more about that pathologically. But think, if my ventricles are thicker, that's going to move it a little bit different, either laterally or medially. If they have any lung conditions, it's going to drive it laterally or medially, okay? So, PMI, this is the only time you're going to be having your hand like this on the anterior chest, okay? So, again, if the woman has big breasts, have her move it to the side, okay? You're coming up underneath here, okay? You're coming up underneath here, feeling for his PMI. He should be in the left lateral cubitus position, and his partner is going to have no problems feeling this. He has a very prominent PMI. Fifth intercostal space, mid-axillary line. So mid-axillary line, fifth intercostal space is exactly where I feel it. Okay, so he's perfect, at least from his heart. Okay, so PMI is right there. I just want to see if your heart rate is going. So, what you did. So, fifth intercostal space, mid-axillary line should be where the PMI is, right? His is very prominent, very easy to find. If you're a little thicker like me, you may not be able to feel it as much. Let me see. Yeah, mine's the same place too, so that's good. So, just, that's the only time you're going to have your hand open like this on the chest for the most part, okay? So let's practice carotids, auscultation point, PMI, and then we'll be done. And make sure if you're guy on guy or girl on girl, make sure you switch so you can, have the opposite sex. And then we'll check out at 11:30. Daniel?
No lesions or masses? Say ah. One more time. Okay, everything looks good. All right. Trachea looks to be the midline. Just palpating your left nose, yes ma'am.
I'm so sorry. Should they be draping the patient for this?
No, they don't necessarily have to drape for the head and neck exam.
Okay.
And that's the end of your exam.